Having health insurance that meets our needs is important, especially as we age. For our viewers who have Medicare or who have loved ones who are eligible, right now is an important decision time. Jeremy Gaskill from Humana is here today to talk about the annual enrollment period for Medicare Advantage. Good morning, Jeremy. How are you?
I'm doing great.
If I can get my act together, we'll get it right. So here we go. Why is it right now an important time for those who are eligible for Medicare?
Yeah, right now, the annual enrollment period runs from October 15th until December 7th. Now, this is when beneficiaries can review their current plan, can change their current plan, and even can enroll in Medicare Advantage plans. It's also the time when they can enroll in prescription drug plans also. And all of this is effective January 1st of 2026.
Now, you mentioned Medicare Advantage and Original Medicare. What's the difference?
Yeah, that's a great question. Original Medicare is federally managed and administered. Now, it covers your hospital stays, it covers your doctor visits. There is a deductible associated with it, and typically members have about 20% responsibility of the total cost. It's important to point out, though, if you want to have prescription drug coverage, you have to purchase a separate prescription drug plan. Now, Medicare Advantage, they are administered by private insurers like Humana. And in addition to covering your hospital stays, your emergency room visits, your doctor visits, they could cover additional benefits. It just depends on where you live. The most important thing with Medicare Advantage plans is that there's a yearly out-of-pocket maximum, so you know the most you could spend in a given year.
Now, what should those eligible take into consideration when selecting a Medicare Advantage plan?
Yeah, I would say cost and then coverage. I think it's important that everyone take a moment, step back, review the current plan that they're on. And even if you like that plan, make sure you understand if there's changes that are going to be made to that plan for the next year, because there can be year over year. When it comes to cost, review your healthcare expenses from the prior year. Think about your budget. Think about your health needs for the coming year. And consider premiums and copays and out-of-pocket maximums when determining what is the right plan that is right for you. And when it comes to coverage, remember, Medicare Advantage plans have networks, so ensure that your physician and your preferred hospital are in the network. And if you're looking at a plan that has a prescription drug benefit, make a list of your current medications. Make sure that they're covered, and make sure you understand if there's additional costs for those medications.
Now, how do Medicare Advantage plans support primary and preventive care?
Yeah, Medicare Advantage plans really emphasize preventive care and care coordination. Your Medicare Advantage plan can include coverage for your routine checkups, your annual screenings, your management of chronic conditions. And all of this just helps you stay healthy and ensure early detection, which just ultimately leads to better outcomes. So when comparing plans, look at what is covered from a preventive care standpoint, look at what is covered from an annual screening standpoint, and make sure you understand if there's any additional costs associated with those.
Jeremy, before we wrap, how can people get help comparing plans or enrolling?
Yeah, Medicare.gov is a great place to start. They have a really neat tool where you can compare plans side by side. There's also a number of professional licensed sales agents that can sit down with you and really help you figure out what is the right plan for you. And if you're interested in specifics about Humana, Humana.com is a great resource.
Now, where can our audience go for more information about Humana?
As I mentioned, Humana.com is a great place to go to understand the plan offerings that we have.
I've been speaking with Jeremy Gaskill. Thank you so much for joining us on Morning Blend, because it's that confusing time of the year. It definitely is.
My pleasure. Thanks for having me.
Thank you.